I was really honored when Jan and Don asked me to do this presentation quite a while ago, because when I moved to Oregon 22 years ago, it was actually to go to Western states. And so I was finishing up my prerequisites, and then I thought I'd go to OHSU, and I eventually found my way to naturopathic medicine, which is what I do now. So it's really an honor to be here, since when I moved here, I actually had the intention of sitting where you are right now. So I was asked to speak about bioidentical hormones because this is a big part of my practice, being an anti-aging medicine. And when they asked me to speak about this topic, I thought, well, what do chiropractors want to know about bioidentical hormones? Because I don't know how it would apply to you, and I know what it's like to sit where you're sitting for many hours and be lectured at and not actually have the information be applicable. So I asked many of your colleagues, about 12 of your colleagues, what would a chiropractor want to know about bioidentical hormones? And this is what the feedback I got. What do hormones do exactly? What are the symptoms of hormone imbalance so that you could identify some symptoms? Pain and hormones, how do they play a role, or how do they interact? Can't the body heal itself? Why do we even need hormones? Synthetic hormones versus bioidentical hormones, what are the options? And then how can chiropractors help? Well, this is a lot of information. In fact, this talk is about a 6-hour talk that I've tried to condense. I certainly don't want you to feel like you're trying to take a drink of water out of a fire hose and receive an inundation of information. So when I timed this at home, it was 1 hour and 36 minutes and 53 seconds. So I'm hoping we'll actually get through it. But what's most important to me is that you get what you came here for, since you chose to sit in this lecture. So if you have burning questions, please ask them or write them down, and I'll make sure I get to them. So here's our journey. We're going to start off by talking about exactly what hormones do. Briefly, we're going to talk about symptoms. And when you had your handout, when you get your handouts from Jan, did she put in there a symptom checklist that you could use to follow along? Is that in there? There is? Okay, thanks. So we're going to talk about symptoms, and that's so that you can start to identify symptoms in your patients of hormone imbalance. We're going to talk a little bit, very briefly, about pain and hormones, since I know many of you probably treat conditions associated with pain. We're going to talk about what can be treated with supplements and what actually needs prescription hormones, and that information will be indirect, but hopefully you'll understand the difference. Why use hormones in the first place? A little bit about synthetic versus bioidentical hormones, the options, and then how you can help. So what do hormones do? The word hormone comes from the Greek hormon, which means to set in motion, which is actually a good description of what hormones do. And I think about hormones as essentially like a key in a lock. So they're chemicals made by glands in your body. They bind to receptors, and then they have certain activities. And they need to fit in that lock exactly, which is why bioidentical hormones tend to have fewer side effects than synthetic hormones, which don't exactly fit their receptors exactly. So what do hormones do? Well, they play a role in growth and development, the repair of tissues like skin, muscle, and bone, very important, especially as you age. They play a role in reproduction, obviously, in your metabolism, your energy level, extremely important for normal brain function and mood. They play a role in immune function and in blood sugar regulation. So let's do just a very brief review of biochemistry so you understand how the hormones are made that we're going to be talking about and how they influence one another. So most of the hormones we'll talk about today come from cholesterol. So they have a cholesterol backbone. You can imagine what happens if we drive cholesterol levels too low in terms of being able to synthesize especially the steroid hormones and some of the side effects of extremely low cholesterol in terms of symptoms. So cholesterol is then synthesized into a hormone called pregnenolone, which is the precursor to make progesterone, which is the precursor to make cortisol. Pregnenolone is also used to make DHEA. The intermediate there is androstenedione, which is reversibly converted to testosterone. You don't need to memorize this, by the way. It's just for your information as a little review. Testosterone is then converted into the more potent form dihydrotestosterone. Androstenedione is synthesized into estrone, and estrone and testosterone are the precursors for estradiol. And estrone is also converted into the very weak metabolite estriol. Got it? All that's somewhat of a review. You guys do get this in biochemistry, right? You do learn this. Okay, so then a little bit about the relationship between hormones. So when you see a dashed line, there's some sort of an inhibitory relationship. When you see a straight line or a positive line, there's a positive effect. And we're going to add thyroid and insulin. And really, really, part of the purpose of this is not just to remember how the hormones are made, but to understand how incredibly complex this web is, and how when you push one pathway, you can actually have an effect in many other areas. So progesterone has a positive influence on thyroid hormone. In fact, progesterone supplementation has been shown to increase T4 and lower TSH. So progesterone, or adequate progesterone, is important for proper thyroid function. Progesterone inhibits the enzyme that converts testosterone into dihydrotestosterone, that 5-alpha reductase. So it may actually have a positive effect on lowering DHT production. And it also has a yin and yang effect with estradiol. Thyroid hormone actually speeds up metabolism of cortisol and can lower cortisol, and then too much cortisol can actually suppress activity of thyroid hormones, so T4 to T3 conversion. Excess cortisol can also lower testosterone production. And cortisol, because it increases blood sugar, ends up increasing insulin and can contribute to insulin resistance. We're going to be talking a little bit about that. And then too much insulin feeds back and lowers testosterone production. Insulin also plays a role in increasing estrogen production in fat tissue. And DHEA and cortisol have a yin-yang relationship. And estradiol can actually lower testosterone, especially in men. So too much estrogen in men can feed back and lower testosterone production. Estradiol also lowers thyroid activity because it increases thyroid-binding globulin, so you have less thyroid available to the tissues. So you see how incredibly complicated this system can be? And this is just the beginning. So we're going to talk about what I call the 5 HormoneSynergy Principles. The name of my practice and the name of my book is HormoneSynergy because of the way that hormones influence each other and also have a greater effect when in balance. And these are the principles that I think about. That hormone imbalance can occur at any age, although many hormones decline with age. And aging accelerates when hormone levels decline. As hormone levels decline, health declines. And this is why I use hormones as part of a whole anti-aging or age management attitude. Diet and lifestyle, extremely important to hormone balance. In fact, when I wrote my book and I came up with the 8 steps to achieving hormone synergy, the first 7 steps are things that all of you do probably in your practice every day by being functional medicine experts. And that's really the foundation for healthy hormone production as you age, in addition to supplementation. But if you are going to supplement with hormones, it is my premise that bioidentical hormones are the best. This is a cartoon from Randy Glassberg. You've probably seen his work around. When you left the house this morning, you were a happy, enthusiastic, vibrant 25-year-old. Do you want to talk about it? Anybody ever feel like they're aging overnight? You do? I do. So we're going to talk a little bit about the sex steroids and what they do. And I think of them as, being like a dance, like as elegant as Ginger Rogers and Fred Astaire. This is estradiol, and estradiol is an extremely powerful hormone. So there's 3 types of estrogens: estradiol, estrone, and estriol for the most part, but estradiol is the most potent. And estradiol comes from the ovaries in women, but after menopause, estradiol is made from adrenal gland precursors. So this is why it's so important for women as they transition into menopause to have healthy adrenal function so they can continue to make as much of their own estrogen as possible. In men, too much estrogen can actually increase breast tissue development, otherwise known as man boobs or moobs. Testosterone is converted into estrogen from the aromatase enzyme, and this increases with fat tissue deposition. So the aromatase enzyme is found in fat tissue, also increases with inflammation and with aging. So you can imagine that if your patients are inflamed, which I'm sure you see a lot of inflammation in your practice, and if there's a lot of fat tissue, especially belly fat or visceral fat, you will make more estrogen out of your testosterone as a man. And of course, that feeds back and lowers testosterone production. So what does estrogen do in women? You can think of Marilyn Monroe as the quintessential estrogenic goddess. So estrogen, very important for breast development in women, and it puts fat on the hips and the thighs and the buttocks. So when you identify patients, or when I treat patients, I often think of them as, are they a higher testosterone, higher estrogen, both type person, because that influences decision making when it comes to dosing. But Marilyn Monroe would not feel normal if her estrogen level was low. Of course, she never made it to menopause. Let's talk about estrogen and what it does for the cardiovascular system. Really important. Estrogen is extremely important to make nitric oxide, so it improves endothelial function. And if you remember back from your biology days, the endothelium is the single layer of cells that lines all the blood vessels. Extremely important layer of cells. So the endothelium is what secretes nitric oxide, which dilates the blood vessels and prevents clot formation and prevents plaque from rupturing. So it plays a role in whether or not someone has a heart attack or a stroke to have healthy endothelium. And estrogen actually increases nitric oxide production because it enhances endothelial function. So it dilates and protects the arteries. It decreases oxidized LDL. So estrogen actually has a role as an antioxidant to prevent oxidation of LDL, which is what furthers the plaque cascade. It can lower lipoprotein a. Lipoprotein a is a very atherogenic form of LDL. Decreases plaque accumulation, has actually been shown to lower coronary artery calcification. So calcification is a late stage in plaque formation, basically the body trying to turn a plaque into bone so it stabilizes it. And so estrogen actually can help prevent that, and it's been shown to lower IMT, so the thickness of the wall of the artery. I put the references on there in case anyone's interested because I do a lot of continuing education. And I like to actually sit with my smartphone and look things up if they appeal to me. So I put references right after the slides in case any of the information in the preceding slide is interesting to you, or you can skip them. So what does estrogen do when it comes to the bone? Well, it's the most important hormone for strong bones. It actually slows bone loss, so it inhibits osteoclasts, but it's the most important hormone to stimulate osteoblasts, so the laying down of new hormone or new bone. Very hard to reverse osteoporosis or actually increase bone density without estrogen. You can slow bone loss with drugs, but for the most part, if you want to rebuild bone or reverse osteoporosis, estrogen is necessary, or testosterone. In terms of the skin, so estrogen increases collagen formation and elastin, so helping prevent wrinkles, necessary for proper vaginal secretions. Extremely important hormone for the brain. So estrogen increases what I call happy molecules in the brain. It acts as an MAO inhibitor and increases serotonin, dopamine, norepinephrine, and epinephrine. It's required for learning and memory. So it actually enhances the cells in the hippocampus and increases acetylcholine production. And you need it for proper attention span. Estrogen also protects neurons from free radical damage and neurotoxicity. And it prevents dementia and Alzheimer's. So it's involved in the health of the cells in the hippocampus. It increases acetylcholine and brain-derived neurotrophic factor, which is basically the glue to keep neurons working together. And it decreases reactive oxygen species, so it decreases the oxidative stress that actually can kill brain cells. If initiated within 10 years of menopause, estrogen's been shown to prevent Alzheimer's disease or minimize it. And when women are given estrogen at higher doses, so a 0.1 milligram patch, it has been shown to improve memory and attention span in women with Alzheimer's disease. One of the most important hormones for the brain. So that's a photomicrograph of the progesterone molecule. How many of you use progesterone in your practices? Does anyone here do hormones in their practices or measure hormones? Okay, so if all of this is boring, you can ask questions because this is a lot on hormones. I thought for some reason chiropractors use a lot of hormones or standard processed products that have hormones in them. Some of you do? Okay. So I see patients coming in with DHEA and progesterone oftentimes from chiropractors. So that's why I thought that there was some education about that, or you were doing a lot of that. So progesterone is made by the ovaries after ovulation in women. So if you don't ovulate, the corpus luteum doesn't make adequate progesterone, and you can end up with symptoms from that. And it's also made by the adrenal glands in men and women, and of course by the adrenals in women after menopause. Importantly, progesterone is a precursor for stress hormone production. The purpose of progesterone, for the most part, its main purpose is to maintain pregnancy. So progesterone means progestation, plays a very important role in the ability to maintain a pregnancy and not miscarry, especially until the placenta takes over. Very important for breast tissue differentiation. So estrogen causes proliferation of breast cells, basically the turnover and dividing of breast cells. Progesterone gives the message, become normal breast cells. Other functions of progesterone. It can help with estrogen imbalance symptoms in the uterus, so preventing heavy periods and uterine fibroids. It may help with androgen excess symptoms. This is probably more theoretical than it is realistic. A lot of women will try using progesterone to prevent facial hair. I wish it worked better, but it does inhibit the 5-alpha reductase enzyme, so it can help a little bit. And it's the precursor for stress hormones. Now, a lot of you, I'm sure, talk to patients about adrenal fatigue and minimizing their stress, right? I mean, because you guys do functional medicine. Does anybody here do functional medicine? A little bit. Okay, good. This is your expertise. This is what I'm hoping that you're doing. Progesterone in the brain. So it calms the brain and improves sleep. And it protects the nervous system. So the myelin in the brain actually secretes progesterone. And women recover better than men after traumatic brain injuries. This is something that we've known for a while. There have been several studies on using high-dose progesterone after traumatic brain injuries. More than 200 have been positive. There have been 2 phase 2 randomized controlled trials that were positive, giving high-dose progesterone to traumatic brain injury survivors. A recent one was negative, though, so I don't know if that's really that's going to be used in practice in hospitals, but there does seem to be some benefit, at least to women who have high progesterone levels, if they actually sustain a brain injury. And probably my favorite hormone, testosterone, that's a photomicrograph of the testosterone molecule, and testosterone is made by women and men. So a lot of conventional physicians don't remember this, and my patients will say, well, my doctor says that women don't make testosterone, and that's absolutely not true. Very important hormone made by women and men. And women, you make 50% of your testosterone through the ovaries. When you go through menopause, you basically make it from the adrenal glands. And if you think about women who are on birth control pills, the birth control pill will suppress ovarian production of hormones. So it's suppressing estrogen production and it's suppressing ovulation, so progesterone production. It does not replace testosterone. So sometimes women can end up with testosterone insufficiency from being on a birth control pill. So what does testosterone do? Well, it's anabolic. It's the main anabolic hormone besides growth hormone, so it builds tissue. It promotes protein synthesis and growth of structural tissue. So very important not just to build tissue, but for healing purposes. That's why men have bigger hearts, lungs, and livers than women. Very important role in growth of muscle mass and improved strength. Probably the most important hormone besides growth hormone for improving lean body mass, so making sure that you don't have too much fat accumulation, especially as you're aging, and increasing muscle mass. Testosterone also plays a role in bone protection. So to some extent, it can stimulate osteoblasts, osteocytes, and chondrocytes. In fact, this is part of the mechanism by which testosterone can help with joint pain and joint recovery. It stimulates production of growth factors in bone, like IGF-1, and it stimulates muscle mass and strength, so preventing falls, especially in the elderly. I call testosterone the Energizer Bunny because I think it's one of the most important hormones for sustained energy. So the type of energy that people can get from testosterone is physical energy, the ability to keep going, stamina. When my testosterone's low, sometimes I can feel like I'm running through quicksand, that feeling like you just can't keep going, or it's just much more difficult. So testosterone's very important for that kind of stamina type energy. Again, another important hormone for the blood vessels. So testosterone has been shown to improve endothelial function in women. It can prevent hypertension, dilate the coronary arteries. Studies going back to the 1940s have shown that testosterone supplementation actually alleviates angina to some degree, which is chest pain from atherosclerosis. Low testosterone increases the risk for coronary artery disease, heart attacks, strokes, congestive heart failure, and death from cardiovascular disease. Doesn't that look like Bill Clinton? There have been more than 20 studies and 2 meta-analyses linking low testosterone and type 2 diabetes. In fact, I've never tested a type 2 diabetic patient who has normal testosterone levels. Testosterone may help decrease insulin resistance and reverse diabetes. And high estradiol may actually worsen insulin resistance in men. Another important hormone for the brain, the aromatase enzyme that is actually found in fat tissue but also in the brain, is responsible for converting testosterone into estrogen. This is one of the ways that a male fetus becomes masculinized, is actually by increasing estrogen production in the brain from testosterone. The differences in the male and female brains are to some extent due to different testosterone levels. So men actually have larger brains than women. This is probably startling to many of you. But the corpus callosum, the area of the brain that is responsible for connecting the two hemispheres, is actually bigger in women. So really, the bottom line is men have bigger brains but less connection between their hemispheres. This is true. Testosterone improves thinking, in part due to conversion to estradiol in the brain. And verbal fluency and spatial sense, the ability to parallel park. That is a very testosterone ability. Prevents depression and improves sense of well-being. Well-being is one of those things that's hard to define, but you know it when you have it. And some of that data goes back to the 1930s. So overall, in summary, testosterone helps with mental sharpness, assertiveness, the ability to make decisions, really important. So testosterone increases dopamine production in the frontal lobe. This helps with decision-making, focus, concentration, and confidence. A lot of women, when they come to me, and not just men, will actually talk about how they have trouble making decisions or they lack confidence like they used to. Especially, attorneys or business owners, women in power, positions of power. So testosterone and Alzheimer's, there's some preliminary research linking the two. Testosterone has been shown to protect against cognitive decline. Low free testosterone is actually a risk factor for Alzheimer's in men and women. Because testosterone, one of the things it does is reduces beta amyloid secretion by neurons. There's been a small study that was published in 2003 showing that the testosterone-treated Alzheimer's patients